Doctor after doctor described having to deny or seriously delay
systematically
care.
targeted the Ukrainian health
Physicians for Human Rights documented the use of chemical weapons.
Wherever healthcare comes under fire, Physicians for Human Rights is there. PHR uses the tools of science, of forensic medicine, to gather evidence for defending, protecting, promoting human rights, and demanding justice. Our work supports healthcare workers who are confronting unprecedented challenges, whether delivering care to the traumatized in conflict zones or facing penalties for providing essential reproductive services in the United States. The surge in global attacks on healthcare is deeply troubling. From Ethiopia to Syria to Ukraine and beyond, healthcare facilities are not just collateral damage. They're now being deliberately targeted.
The fact that there was no warning given prior to a strike may well constitute a war crime.
Attacks against healthcare are unfortunately part of the conflict here in Ukraine.
We equip our partners with training to document sexual violence, torture, and mass atrocities. We empower communities to seek justice.
How can we build accountability for these crimes if we are missing adequate evidence?
PHR's innovation includes technical improvements like Medicap, our award-winning mobile app enabling clinicians to securely store and transfer forensic evidence of sexual violence.
I give the floor to the Physicians for Human Rights.
Our recently published report confirmed that women and girls are severely affected by the violence against healthcare. While our work takes us around the world, the need for our expertise is equally urgent in the United States. More than 100,000 people seek asylum at U.S. borders each year. Many are fleeing traumatizing violence, including torture.
I'm here with Physicians Human Rights with a team of clinicians here to evaluate people who are coming to the border.
Asylum seekers who receive forensic medical evaluations from PHR's network are twice as likely to be granted asylum.
Child internment camps, that's what I said.
When the U.S. administration forcibly separated families at the border, PHR sounded the alarm, providing crucial evidence of the policy's devastating impact.
Physicians for Human Rights, they called this torture.
Abortion is healthcare! Abortion is healthcare!
We also champion reproductive rights, amplifying the voices of doctors navigating restrictive abortion bans.
Physicians for Human Rights, who've looked at Idaho's law and says it prevents a lot of things. They disagree with you on the facts.
In the face of excessive use of force by law enforcement, our research exposes the dangers of crowd-control weapons and dismantles pseudoscientific justifications for deadly police violence.
According to a newly released report by the Physicians for Human Rights, that term, excited delirium, has racist and unscientific origins.
Since 1986, we've made historic strides, including sharing in the Nobel Peace Prize for our efforts to ban the deadly scourge of landmines. We've made huge progress, but we need to do a lot more. Our partners are still on the ground every day, wielding the power of science and medicine, because we know that through evidence, change is possible.